Hi, today is November 24th, 2023. Welcome to my case study diagnosis for Johnny Hernandez Perez for Dr. Terry Villareal of Grand Canyon University, Chemistry 101. Let's get started. Alright, so the initial case facts, we have a 17-year-old high school student. He is 5 feet 10 inches tall, weighs 142 pounds. He presents to us with symptoms of nausea and soreness after a 4-hour workout session 2 times a day for his football training. His mother also reported that the patient seemed confused after coming home from training, and we have an initial blood pressure of 145/92, which is a bit high. So, the first test we're going to do is a glucose determination. There were 3 tests performed for this. There was the glucose meter portion. For this one, we take a device and take a blood sample and place it onto a strip that goes into the device. The glucose in the blood reacts with the glucose oxidase to make gluconic acid and hydrogen peroxide. The meter then applies electric current to the hydrogen peroxide and measures the current to determine the amount of glucose in the blood sample. The second test is a Benedict's reagent test. The reagent contains copper ions in it, specifically copper 2, which reacts with aldehyde on the glucose and oxidizes it to make it a carboxylic acid. The copper will begin to turn to a red color while it's doing this, and the final color of the reagent can indicate the amount of reducing sugars in the blood. The third test we are going to do is we're going to take a reagent strip and use it with a urine sample. It works very much in the same way as the glucose meter, except that the hydrogen peroxide reacts with horseradish peroxidase and presents a colorless potassium iodide to turn it into different colors based on the level of glucose. These tests can help us determine if there are abnormal levels of glucose that could be causing the problem. So these are our results. The glucose meter read a concentration of 115 milligrams per deciliter, when the normal range is between 70 and 100 milligrams per deciliter. The Benedict's reagent, the color remained blue, which indicates that the level of reducing sugars is less than 100 milligrams per deciliter, which is normal. The reagent strip showed that we had a light green color and indicates a level of 100 milligrams of glucose per deciliter. These results indicate that glucose levels for the most part are fairly normal. Now the next portion we're going to do are enzyme kinetics. Tests using spectrometer are used to measure creatine kinase and lactate dehydrogenase levels in the blood. Creatine kinase is an enzyme that helps convert ADP to ATP and usually only functions inside the cells of organs and muscles. ATP derived from creatine kinase drives the first step of glycolysis, where hexokinase converts glucose to G6P. A second enzyme converts G6P to 6-phosphogluconate, which produces NADH. And this NADH emits light at 340 nanometers, which can be picked up by the spectrometer. Lactate dehydrogenase converts lactate to pyruvate and along with NADH, which again can be picked up by the spectrometer. These tests can determine whether there is tissue damage somewhere in the body. Now these are our results. This is a control sample for creatine kinase enzyme activity and lactate dehydrogenase enzyme activity. And we can see that the patient absorbance is much higher than the control sample. And over here we can see the graphs as well. Now the slopes of the creatine kinase absorbance chart and lactate dehydrogenase absorbance chart were calculated to be 244 U per L and 360 U per L per minute respectively. When comparing with the normal levels as shown in this table, we can see that the levels are much higher, indicating that there is tissue damage somewhere in the body. Now the third portion that we're going to do is a urinalysis lab. There are several components to this lab that are going to be performed. We're going to do a protein test where 8 milliliters of urine are boiled and examined for precipitate formation. If the precipitate is initially formed, acetic acid is added and the sample is boiled again to see if there is still some precipitate formation. Reagent strips were used to determine several things such as specific gravity, which is the ability of the kidneys to concentrate the urine, the pH of the urine, which can indicate alkalosis or acidosis, as well as presence of ketones and bilirubin. These tests can determine whether there are conditions such as renal failure, a urinary tract infection, unregular diabetes, dehydration, heart failure, kidney disease or failure, among other things. An electrolyte panel was also performed on the urine. The electrolyte panel measures ions such as chlorine, potassium, and phosphate, among other things. It can determine conditions such as renal failure, dehydration, crush injuries, renal disease, and other conditions. The color of the urine was also noted. The color can determine whether conditions are present based on the actual color or appearance of the urine itself. For example, liver disorders will often make the urine turn dark brown. Hypercalcemia will make the urine turn blue-green. Dehydration can make the urine appear cloudy. And an Ehrlich's test reacts with urobilinogen, and this is performed to observe color changes that can determine causes such as hemolytic anemia or antibiotic use, which can affect the levels of urobilinogen in the urine. And these are our results. For the protein test, we can see that a precipitate was formed at first, but after adding the acetic acid and boiling it again, there was no precipitate left. So the results are normal for that. The specific gravity was at 1.010, which falls within the range of 1.005 to 1.0030. It might actually, now that I'm looking at it, might be 1.015, but it still falls well within the normal range. The pH level indicates that it is at 6.0, which falls in the normal range of 5.0 to 6.0. Granted, it's on the high end, but it is still within the range. For the ketones, there is very trace amounts of ketones in the urine. We can see that there's only 0.5 millimoles per liter. And same thing for the bilirubin. There's small amounts of bilirubin in the urine. For the Ehrlich's test, the urine turned darker yellow and there's no pink color, which indicates that there's no increased level of urobilinogen in the urine. The initial urine color that was noted is reddish brown, and the electrolyte panel indicated that there are slightly elevated chlorine ions in the urine. So, with all of this evidence, we see that the glucose levels are relatively normal, so there's no hyper or hypoglycemia. Both creatine kinase and lactate dehydrogenase levels are elevated, indicating that there is tissue damage somewhere in the body. And the urine results are all mostly normal except for the chloride ions present in the urine and red-brown coloration of the urine. So when we take everything into consideration, with the patient's history of undergoing strenuous activity for an extended period of time, his CK and LD levels are now elevated with a reddish-brown colored urine with chloride ions present in the urine. Patient has symptoms of nausea, soreness, and confusion. When we take everything into consideration, the patient is most likely to have rhabdomyolysis. Rhabdomyolysis is a condition where the muscles start breaking down due to several factors. And the symptoms of rhabdomyolysis can include nausea, sore muscles, confusion, and dark urine. Rhabdomyolysis can be brought on by high-intensity exercise, similar to what the patient was doing for his football workouts. Tests for this condition will show elevated levels of both creatine kinase and lactate dehydrogenase because of the tissue damage to the muscles. The treatment plan that has been indicated for this patient, we're going to start him on an IV to flush out any muscle proteins from the body. We're going to encourage the patient to drink plenty of fluids and to just rest for at least 72 hours to allow his body to recover. The patient will return to get more tests done to determine those CK and LD levels and see if they're starting to go back down. If the levels are back to normal, the patient can return to light physical activity and then build up to being able to do full physical activity for only 2 hours per day instead of the 8 hours that he was initially doing.